Hello everyone, this is the MSJ RFL team Run for Hope, and today we'll be talking about ovarian cancer.
So what is ovarian cancer? As most of us know, cancer is the uncontrollable growth of mutant cells, and they invade our body. So ovarian cancer specifically is the growth of tumors on the outside exterior of the ovaries. Very commonly, it begins in the fallopian tubes, which then spreads to the ovaries, which the fallopian tubes are connected to. This is in the stage 1 of ovarian cancer. Afterwards, it can spread to the rest of the body, harming the entire body. Some key statistics show us that ovarian cancer is a very common disease amongst women. So I'm going to go into the types of ovarian cancer next. First, this is a picture of the ovary and the different parts inside of it. So the most common type of cancer in the ovary is the epithelial cell tumor, and this accounts for about 90% of all ovarian cancer. The second most common type of ovarian cancer is the stromal cell tumors. This begins in the hormone-producing section of the ovary and accounts for about 7% of tumors. Then finally, there's the germ cell tumors, which are the most rare and occurs in younger women. So next are the symptoms. And here is a person in the front view and the back view. So one of the symptoms is a change in appetite, another is bloating, and in addition, sometimes you feel changes in your menstrual pattern. In the back, you have back pain and sometimes weight loss. And frequently urinating is another one of these symptoms. So the most symptoms are benign, but if you experience many of them for greater than 12 months, you should get a checkup. Risk factors of ovarian cancer. So one of the risk factors of ovarian cancer is old age. Although ovarian cancer can occur to anyone at any age, it is most common in women from 50 to 60 years old. It is also sometimes an inherited gene mutation. A small percentage of ovarian cancers are caused by gene mutations you inherit from your parents. It is often inherited with the breast cancer gene. Family history has a large impact, as people with 2 or more close relatives with ovarian cancer, colon cancer, or breast cancer have an increased risk for the disease. Also, a personal history of breast cancer is often an indication that you may be at high risk for ovarian cancer. Finally, estrogen hormone replacement therapy, especially with long-term use and in large doses, can increase your risk. And last, menstruation starting at an early age or ending at a late age can increase your risk for ovarian cancer. To diagnose ovarian cancer, there is no reliable screening test thus far, and more research needs to be done. However, at your routine gynecologist exam, you can get screened by either taking a blood test or an ultrasound. This is only recommended for those with a high risk. CT scans can also detect abnormal tissue, but it cannot determine whether or not the tumor is cancerous, so a surgery and then a biopsy needs to be performed by a doctor. In terms of treating ovarian cancer, you can perform surgery in the earlier stages such as stage 1, where the cancer is limited to the ovaries. Chemotherapy is also another option. In addition, you can also perform hormone therapy. This is more effective for stromal tumors.
The chances of survival depend on each person, but here are some stats collected from research. Without considering the stage of cancer, 72.4% live for at least a year and 46.2% live for at least 5 years. In stage 1 ovarian cancer, where cancer is found in one or both ovaries, the relative 5-year survival rate is around 90%. Stages 1, 2, and 3 all have substages of A, B, and C, where A has the least spread of cancer cells and C has the most. In stage 2 ovarian cancer, cancer is found in one or both ovaries, and it has spread outside the pelvis area into areas such as the uterus, the fallopian tube, or other tissue within the pelvis area. The relative 5-year survival rate is about 70%. In stage 3, cancer is not only found in both ovaries, has spread to outside the pelvic area, to other parts of the abdomen or to nearby lymph nodes, and it can be found in the surface of the liver. The relative 5-year survival rate is 39%. And finally, for stage 4 ovarian cancer, cancer has spread beyond the abdomen to other parts of the body, including the lungs, the liver, and cancer cells are present in the fluid around the lungs. The survival rate is 17%. Treatment at this stage includes surgery to take out as much tumors as possible, followed by chemotherapy. And here are some other very interesting statistics based on the stages of ovarian cancer and also ethnicity and race. So, what are some ways to prevent ovarian cancer? If you're concerned that you're at risk of getting ovarian cancer, it is highly recommended that you discuss with your doctor. You can discuss your family history, get a genetic testing to check for mutations in your BRCA1 gene in chromosome 17 or your BRCA2 gene in chromosome 13. If you do happen to find any mutations, some people decide to take cautious measures and discuss with their doctors possibilities of having surgery. Options include removing your ovaries, getting a hysterectomy, which is removing the uterus, or a tubal ligation, which is severing off the fallopian tube. Taking birth control pills is also a way to reduce your risks. They contain the hormones estrogen and progestin, which highly reduces your risk of getting ovarian cancer. However, you must keep in mind that taking oral contraceptives do come with risks, and they may increase your chances of developing breast cancer. So, no matter which option you choose, please consult your doctor.